All right. So, hi everybody, and welcome back to my channel. Today, I'm so excited because I've got with you Onai Muchemwa, who is an associate HR director, and we're going to talk all about how we work with our HR colleagues to enhance our careers, but also how to have some of those tricky conversations, such as bullying and harassment. So without further ado, let me introduce you to Onai. So Onai, say hi and just tell us a bit about yourself.
Hi, Sabrina. Hi, everyone. Thank you so much for having me, Sabrina. It's taken a long time to finally get on your channel, so I'm glad I'm here. But yeah, I'm Onai, as Sabrina said, and I am an HR professional. I'm currently working as an associate director of people in NHS, but I also do my own HR consultancy work, and I will share a little bit more about that as we speak.
Just tell us a bit about what your current role is and how did you get there, Onai?
Yeah, so my current role, Associate Director of People, I'm currently at Chel West at the moment. So I started my HR career in 2014. Prior to that, I was a service operations manager. I worked in MENCAP, which is one of the biggest charity organizations for supporting people with special needs. So I was in MENCAP for a really, really long time. And I went into a management role and I thought, I'm really good at this management stuff. But what I really used to get frustrated by was when I spoke with HR and they would advise me to do this and that and this and that. And I'll be sitting there thinking, no chance. that's not what I'm going to do. I want to do something different. And I just thought to myself, you know what, I'm going to go and study HR. And, you know, if I study HR, I'm going to have different conversations with managers. So I did my master's degree in human resource management. And then I got my first HR advisor job in the NHS. And then I just progressed from there. So I've covered different roles from HR advisor to senior HR advisor. I did HR business partnering. I was an HR business partner for a really, really long time. And then I was a senior HR business partner before deciding to take the next step into associate director of people. And guess what? The same things that I was frustrated about HR back in 2012. I find myself having to say those things now. So I feel like I've come full circle.
Cool. And what are some of those frustrating things? Because what really resonated with me is when you said, as a manager, you go to HR wanting support, and sometimes it feels there isn't any support. You might as well have read the policy yourself and maybe gone off and done it. Because essentially, sometimes that's what it feels like the HR person's telling you. So what are some of the things that frustrate you now?
And you know what, Sabrina, I do hear a lot of managers say that, and actually some of the work that I am wanting to do, which is why I was having these conversations with you earlier about, you know, what does good HR support look like to you as a senior nursing leader? So some of the conversations I want to have is actually, what does good HR support look like? Because what you're saying is I hear it a lot. And for me, it's more than just signposting people to a policy or a document. It's more than just following a strict policy or a procedure. Actually, it's become bigger than that. It's more about conversation. It's more about really thinking about people experience. It's more about how do we support people that are managing people to give people a better work experience. So there's so many things that come into play. So one of the things that you are unlikely to hear me say when you come to me for advice is, you know, the policy says that and the policy says this. I might mention it because if it helps the conversation. But actually, you know, the conversations need to start differently and end differently because it's not just about policy. It's about people and how we enhance people's experience through conversations and practice.
Right. And just on that point, just a little bit, like you say, it's about the conversation. There's something about people. So what is your view of what good HR should look like for people, for those nurses or the people who are not nurses listening, so that people can spot it or work with their HR colleagues to say, this is what I need?
So I think, you know, and I'll start off by saying, you know, good HR is neutral. One of the things I really loathe to hear is when people use HR as a pawn. So some people will say, you know, for example, some managers will say, oh, you know, I'm going to get HR onto this. as a tool to kind of conversation a certain way. Some people will say we worry about HR being involved in conversations concerning them. So I think when we start to get to a place where if someone says, I'll bring HR in, it's not a problem, because HR is going to do the right thing. They're going to be neutral. So this whole thing about HR being for managers is one of the things that we really, really want to dismantle and disavow right now. HR is for everybody. So you should recognize good HR when it's irrespective of whether you're a manager or you're one of the people that is not a manager, that is going through a process or whatever. You start to recognize that it's okay to have HR support, because
career, how can HR be supportive in terms of thinking and working with you on that?
It's how people recognize what HR can do for them. I think we've got quite some work to do for people to understand HR. HR is really wide. There's so many concepts. I mean, the model that I like and that I last checked, sometime last week, has about 30 different concepts of HR. They all come together, but there's about 30 different things. But I don't think people always recognize what HR can do for an individual in an organization. We usually associate HR with things like recruitment or policy development, or if you want to understand your annual leave, or there's a process that you're under that you need to follow, things to do with pay. But actually, HR does the full breadth of things. Learning and development, talent development is a big one for me. So, people can proactively approach HR to discuss their development needs, to understand what is on offer. Health and well-being, we're talking a lot about it, and HR is doing quite a lot of work in driving that proactively through the organization. But actually, people can have a separate conversation with HR to say, what you currently have doesn't suit me. What else can I have? Can you develop something that is more supportive, that is more specific to my circumstances? People can talk about, can want to understand a little bit more around how pay structures work, if they're concerned about things like their pay. People can talk about, even if they're applying for a job and they need support with interview skills. Some people will tell us they haven't interviewed for a long time and they need support. HR can find ways to support you through the learning and development function, or whatever people call it in the organization. And that's what I'm saying. People have got to feel able and comfortable to pick up the phone and just speak to someone in HR, not just when things go wrong. So you're absolutely right, Sabrina. And I hope to see more of that.
And you're so right. And I really like the language that you use, because I know you're really big on language as well, in terms of saying talent development as opposed to talent management. And maybe just say a bit more on why you use that term and not what we normally see, which is the talent management.
It's and it's stuff I've been thinking about for a long time, Sabrina. We've worked together, and I know you're very much like that as well. You're very much about the people element before process. And one of the things that I've worked out now, which really helps me in how I do HR, is actually people respond to language. And when I put myself on the other end, if I'm having a conversation with somebody, how do I want to hear this message? How do I want to have this conversation? So things like management, things like, and I think I've done, a list. I've started putting together a list about some of the language that we're using and promoting in HR, which actually get in the way of people just participating in what we're trying to get people to participate in. It stops people from engaging. Some of the language is old-fashioned. Some of the terminology has got no place in today's workplace environment. So I'd really like us to start thinking about how we can use more people-friendly language. If I'm having a conversation, how do I want somebody to craft this message and deliver this message? And what are the words that would make me feel some way that I don't want to hear? What are the words that would make me feel, do you know what, this is a conversation I want to be part of, and I'm going to do my best. Even if it's an investigation process, for example, that's key, because those are the kind of things that people struggle to participate in, or even a performance management process. So if somebody is finding it difficult to in certain areas of their work, and their line manager starts a performance development process, I'd rather hear it as performance development as opposed to performance management. So it's little things like that. I'd rather hear it as, I've got a review period rather than a monitoring period.
Yeah.
So things like that would make me think, oh, do you know what? I really want to participate in this and get some resolution to this, because I feel the language respects me as part of that conversation.
Great. And like you said, I've seen your list on LinkedIn, so I will put it in the description, because I just sort of thought it's really thought provoking. Like you say, words have meaning, and if somebody thinks it's a review, if you're monitoring, then sometimes people just do the bare minimum, don't they? Their heart's not in it. Where if you're reviewing and you're developing, to me it sits differently. It sounds different.
Absolutely. And the list is growing, Sabrina. I had somebody, a private message me on LinkedIn, and they're a nurse. Mm-hmm. And they say they really struggle when people just refer to them as the agency nurse.
I know. Or the band 5 or the band 6. So you sort of go, this person's got a name.
Absolutely. So that's going on the list as well. Let's talk about the agency nurse, and let's find a more, a better way of addressing, our colleagues that come through to us on the locum.
Yeah, no, definitely. And I guess it's another conversation to think of, because I guess some of agency nurses might feel they can't get any support from HR, but it might be another conversation to have. Just putting that there.
There's so much to unpick, Sabrina. So much.
And we talked about talent development, and how do you see HR or nurses, senior nurses or junior nurses, any nurses within the organisation working with their HR colleagues to develop? We talk a lot about compassionate leadership, or just leadership or culture, where people feel able to have conversations earlier before things get to a point where it feels really late in the process. How do you think nurses can work with HR?
Do you know what? And this is the HR business partner in me coming. Mm-hmm. And I think HR has got to do a lot of work in understanding, nursing, and how it has evolved over the years. I mean, we know things like, staffing shortages and increase in demand. And traditionally, we've done things like workforce planning. Let's help them with the workforce plan. Let's ramp up recruitment. Let's get the numbers in. And a few years ago, that's what out of it saying, this is how we help nursing. But actually, I think the conversation goes deeper than that. So if we think about how nursing has evolved over the years, I mean, even talking about the route to entry, we used to have enrolled nurses, and then we have diplomas, and then we had graduate nurses, and even now we even have, is it nursing associates?
Yes, yeah. Yeah.
So even that. So the old norms and the new norms that come with that involvement. And then you talk about the nursing workforce profile. We have so many internationally experienced nursing colleagues joining us every single day. When you look at the generational differences that we have in nursing, it's the most diverse we've ever had in history in terms of the generational differences. So I think there's something about how HR can really start to understand some of the things that nursing is having to come to grips with. And some of the challenges that nursing has really had to come to grips with. I mean, COVID, I won't even labor it, but nursing profession was one of the ones that was the hardest hit. And then when you start to think about everything else that we're going through, the uncertainty around, recession, the economic crisis, we're talking about Brexit, we're talking about movements, we talk a lot about race, especially in the NHS and things that come with that. We're talking a lot about artificial intelligence. How does it start to make its way into nursing, and how do we support people through that? So there's quite a lot of things that nursing leaders have got to manage and have got to kind of consider in how they support nurses. And it's HR's job to understand all of that. So it's not just about how many staff do you need today? What's your recruitment pipeline? We can help you with that. It's actually how do we help you start to bring all of these things that you are having to consider and help you kind of develop your workforce. And development is not just about career. It's about, the experience of our nursing colleagues at work. It's about reward. It's no longer enough to say to people, you are in nursing because you care, so that should be enough. And it's the same mindset shift we're seeing in the charity sector, where previously, the conversation was, you're in the charity, so the salary doesn't matter. But actually, things are really different now in the context of how we live. So it's different conversations now that HR have got to have with nursing. It's different research now that HR has got to be doing for nursing, and it's how we bring the insight of that to you, or nursing, the nursing leaders, to say, this is what we need to be thinking about our workforce. What are the specific pieces of things that we need to do, that we can do differently, that we can build on, that we can change, that we can shift, because there's just so much. And nursing, the nursing workforce, usually in most NHS provider organisations, is the biggest of the workforce, isn't it? So, there is much need to really have a focused, deep dive into what is the nature of the support that is needed. It's different. And if our nursing leaders are supported to understand some of those constructs and some of those, and how they interplay with employee experience, that really helps in terms of the collaborative solution planning, because they're not just thinking from a service demand angle. They're not just thinking from we just need to deliver the patient care. They're also thinking from, actually, to get the patient care right, we need to think about all these other things for our people. Complex conversations, Sabrina, that could take us a day to talk about.
I know, but there's lots of gems in there, and hopefully in another conversation we can unpack some of that. Like you say, it is, I find some of the new nurses coming through are thinking about, how do I get from a band 5 to a band 6 role in the next 3-6 months? Whereas before it was, to have X amount of years, and so that we're not discriminating against people, we've got to be really agile, or else we will lose really smart people. Plus, as you say, people come in with lots of experience, especially our migrant nurses. They've got years and years of experience, but also some people come to nursing as a second career as well. So lots to do. Any tips that you've in your many years of working in health that you would give to, I guess, senior leaders to think about how they build those relationships with their HR colleagues, and not just see it being as, dare I say, Sally from HR, but but being a wider part. The way I was thinking about it, Onai, was, as a nurse, you work in a team, and you call it the multidisciplinary team. So that's the clinical team that helps you look after the patients. But I think there's a wider structure around nursing, of which HR could be that wider multidisciplinary team that's outside of our clinical setting, but helps us very much to deliver that high quality care. So any tips on how you've worked with different managers to get the best out of the workforce, or for the workforce?
Sure, Sabrina, and and what I always say, it's a two-way thing for me, and it's one of those things. Sometimes HR pulls, operational leads, follow. Sometimes operational leads, lead, and HR follows. It's how and I talk a lot about stakeholder dialogue and how to have sensitive conversations. These are some of the sensitive conversations, because if I take for you, for example, Sabrina, in your role, very senior manager, you have a vision, you have CQC on your back, you have things that you have to deliver, or KPIs for the organization. That's what's keeping you up at night. And I'm coming in as HR, and I'm talking about well-being, and give people time off, and give people flexible working and things like that. And it's not always immediate for people to be able to make those connections, because they're very different. The outcomes at a point in time can be very different. So for me, I think, and I've been quite fortunate to work with very collaborative nursing leaders in my time. And what's always been helpful was when they were open to listening and hearing, and say, do you know what, Onai, this is your area of expertise. I will be led by you, but what I just want to make sure is that, we meet our KPIs, or we reduce this risk and things like that. And very, very clear direction, very, very clear outline of what you as a nursing leader, you are wanting, where you are expecting, where you want to get to. And my job is to help with the people planning elements of it. And I remember I worked with a very, one of the operational leads that I have so much respect for, and I learned a lot from them. And I was having a conversation with them about, I think it was the staff survey results, if you're in the NHS, and actually talking about the nursing, nursing colleagues at that time, actually, and we're just looking at the staff survey results for the nursing colleagues for that area. And I was suggesting all these really lovely things that we could do to help people feel more engaged. And she sat there and she just looked at me and she said, okay, Onai, I hear what you're saying, but where is the money in all of this? Because it all comes down to money. It's important to look after people, but we've got to make it balance. We've got to make the money balance. We've got to do it. So that taught me a lot about actually how do we balance what we want to do for people with actually what we allow to do by the constraints of the finances, of the budgets. That it's got to make sense, because we just haven't got the luxury of just doing things. And it's about how we work out which are the most important things to do. So I really liked that candid challenge that I had from that person, and I've carried it, throughout my time. So if I'm coming to you, Sabrina, with a proposal and a plan, I will show you how it meets the money.
Yeah.
To you, that's what keeps you up at night.
That's such a good example. In NHS, we do have stewardship of the public purse and public money, and to have a HR colleague that sort of understands your pain as well.
Absolutely, and that's where the magic lies, I think. And it's one of the things that I remember very vividly, again from another operational manager that I worked with, and they said to me, Onai, at some point in your role as an HR person, if you're sitting with a nursing director and you're having a conversation, someone coming in within the first few minutes shouldn't be able to tell whether you're the associate director of people or whether you're the chief nursing officer. Yeah. Because your conversations have got synergy in them. You understand the business, you understand. So as you're talking, you're not talking HR, you're talking about the business and you're talking about the people. And it's only after a few minutes of spending time with you both that the person should be able to say, oh, nice, HR person. Yeah. So yeah, it's it takes some learning. It takes building relationships with people. It takes that sensitive stakeholder dialogue that I was talking about. It takes developing your knowledge. So when you're speaking to people, you're speaking from a position of knowledge, a position of influence and impact. It's a myriad of things, but really all of them equally important.
No, definitely, and I hear that. Thank you. What I was thinking of is, do you have any advice? Because obviously you've been in HR 2014, so within, and this is where I'm 8 years, you've managed to go from, I guess, starting off in the field to an associate director role. Any advice you'd give to somebody thinking of going into HR, of how they can get to your levels, and what banding is your level, just so people understand where you started and where you are now?
Okay, so I started as a band 5, and I was quite fortunate. Well, not fortunate, but I managed to start as a band 5 because where I had previous operational management experience, line management responsibility for many people, I at least had some knowledge and some understanding of how we apply HR policies and procedures. And the role that I went to as an HR advisor was predominantly that, advising managers on policies and procedures. So I was able to make that move. So I suppose what I did very well there, which I didn't realize I was doing, was use my transferable skills, identify my transferable skills. And that's what I sold when I went into my interview. And then, Sabrina, I get asked this question a lot in terms, about how I progressed so quickly. And it's a combination of hard work, fortune, think I've been in the right place at the right time. Sometimes when we've had restructures and an opportunity has come up, and I'm there, and they need somebody, and I'm there. But I remember when I transitioned from my Band 8A HR business partner to my Band 8B senior HR business partner. Again, it was on the back of a restructure, and there was a gap in the senior HR business partnering team. And I said to the HR director at that time, completely out of my comfort zone. I went in there and I came out shaking. I was like, what's that mean? But basically, I'd gone to her and I said, do you know what? I know I've been a Band 8A for only 6 months. Give me a chance. I know I can do this job with your support. And I outlined all the things that I was going to do. I outlined where I think my gaps were. I outlined all the things that I thought I was going to do. And I gave her my time scale. I offered a time scale, and I said, within 6 months, I will be your 8B. Just give me a chance. And of course they did. But what I realized then was actually I had to come out of my comfort zone to have that conversation. I would never have seen myself as someone that would have that kind of conversation. So that's one of the things that I would say, think about what's stopping you from having some important conversations, some conversations that could lead you to the next stop. Is it fear? Is it worry? Is it anxiety? And just bite the bullet. And what really helped me as well is I started at that point. I worked with a manager that taught me about networking. And again, I had never been a networker. I'm not I wouldn't have been the kind of person that would have been, doing stuff and going out and meeting people. But actually, I started to understand what networking is. So it wasn't what I thought it was. Actually, networking is who are the people that I can just send an email to? Who are the people that I could just reach out and say, I'm looking for this and that. Have you got it? Who are the kind of people that I can say on LinkedIn? I'm following 3 people at the moment that who've been where I want to go and done what I want to do. I follow them. I DM them constantly. If they do something that I see on LinkedIn, I DM them. I ask them, how did you go about doing that? I've never met these people. I've never had a conversation with these people. I haven't asked these people to mentor me or anything. But actually, I've got better, with using my network and how to expand and reach my network. So, those are some of the things. I think we talk about these things all the time, but we don't always go down to the real basics of how to do those things.
Yeah.
But those are some of the things. And finally, Sabrina, I'll just say one of the things, to take away is, which I'm going to disavow right now, when we think that we are not ready, you are.
Yeah.
You are. The minute you have that thought about, should I go for this? I could go for this. You are ready. So whatever else thought that comes into your mind about, oh, maybe it's not the right time, maybe you haven't got it all, just disavow that. Cool,
great. And what banding are you now?
I am a Band 8C.
Fantastic. But what I want to say is thank you so much. I know you spoke about your current role and you're doing, you got your own consultancy, haven't you, Onai? And you could just say a little bit to people about, what that is and what that entails and where people can connect with you.
Okay. Yeah, so my consultancy is People Matter, People First. And essentially it's just doing what I'm doing in my associate director of people role, just working differently. I've worked in the NHS for a really long time, but I wanted to work with different sectors as well. So I'm doing I'm wanting to do quite a lot of work in the third sector and social care. And, I just a different way of adding value. I want to see, different way of adding impact, and just different environments to shape HR in. So yeah, and just really deciding when and work and how I work. And the beauty of consultancy is I can pick up a project and finish it and then move on to a next project that is different. So I could have decided to go up the next logical step, which would have been Chief People Officer, but actually I decided that I would get more enrichment if I did consultancy, because I can get my hands into many different types of things. So my role is not defined. I get to pick and choose what I want to do at a particular point in time. And that's the kind of thing that I'm looking for right now.
Great. Sounds amazing. And I wish you well, because I know I've worked with you and I know you're an amazing HR partner, an amazing person to work with. So I know you'll be really successful. But thank you so much for today. And colleagues, as Onai says, when you think you're not ready, you are. So let's be bold and brave together. But reach out to your HR colleagues. Think about people first, and people matter. And thank you all so much for watching.
Thank you. Bye-bye.
I will stop.